So, sir, I read in your profile that you are into robotic surgery. So, my first question would be a little technical. Do you think robotic surgery has reached its full potential, or do you think there are still chances of correction and improvement in it? Because as a dentist, we don't have robotics in dentistry as of now.
So, robotics, Ruchir, is a way of treating diseases, especially surgical way of treating diseases, in which we have a very small camera which usually enters through the umbilicus, and all kinds of pelvic surgeries, especially when we have diseases in the pelvis, which is the region below the umbilicus, especially for the prostate or maybe a kidney transplant. So robotics is a very novel way of treating those diseases in which the patients have excellent recovery. We have a very high definition camera which enters through the umbilicus into the pelvis, and then there are instruments which are controlled by a console. So robotics is not actually robot operating the patient. It is actually a surgeon who is operating the patient. The only thing is that he is sitting on a master control, a master computer, and he is maneuvering those switches on the master computer, and the instruments are doing the job. Robotics still is evolving. It has a long way to go, and there are two diseases especially which have made the future for robotics. One is the prostate cancer. So prostate cancer is one of the very leading cancers in men who are over 40, and in US there are special screening programs for them to screen people who are above the age of 40 years for prostate cancer. And robotic radical prostatectomy currently is the procedure of choice. It has revolutionized. Earlier we used to do prostatic cancer surgery with this much long incision, 7 inches, 8 inches incision. Patients used to stay for around a week or 10 days in the hospital. But with robotics it has revolutionized. Patients, most of the patients would go home after 1 day or 2 days of surgery. And more importantly, robotic is going to be a global connect in the surgical community. Once we evolve with 5G, currently we are in 4G, with 5G we can help surgeons across the globe. Maybe I'm sitting in India, I can operate in the US, or maybe somebody is sitting in Australia, he can operate here in India in the patient. So there's a lot of improvement going on in robotics, and especially for pelvic surgeries and maybe some role in cardiac surgery, it's going to revolutionize things for the future.